Joining us live right now, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Good morning, Joe.
Hey, Ray. How you doing?
I'm doing well. You know where I'm going to start, don't you?
I think so.
Okay. Broken tibia.
Yeah.
How long? I know you haven't seen the x-rays.
My
I know you haven't seen all that stuff, but take us into a break in that tibia. Is he done for the year?
Well, I think he's done for the year, but let's lead up to it.
Okay.
I think he's done for the year, but what is intriguing to me about this injury with Andrew Bogut that I kind of want your listeners, are such a insightful group, your listeners, and so smart, is a thing in our office that we call the mechanism of injury. So every athlete that comes into a sports medicine clinic, we kind of want to know how the injury happened. So we have soccer kids who come in and we know what it means 50-50 ball, and you kick the ball at the same time and it leads to a knee or an ankle injury. Or the dreaded plant twist pop. This was not, if you were watching the Cavs game, for everybody who saw that, which is most of your audience, the Andrew Bogut injury wasn't the plant twist pop of an ACL, so we knew that. What we call this injury is really he kind of got leg whipped. And in sports, this happens in soccer, football, basketball, where you get leg whipped. I would really liken it quite a bit to the injury of Kevin Durant. If you saw Durant's injury that happened less than a week earlier, about a week ago now, Durant got leg whipped and then rolled up on a bit. And in fact, the two mechanisms were pretty similar. And I would take a step back to tell you that with Kevin Durant's injury, I think what makes it a little bit of a uncertainty as to how long before he recovers, and they're saying 4 weeks and then we'll check him again, as I'm just looking in from the outside because he didn't stop at my office this week either, is that he tore his MCL, so a grade 2 MCL. Steph Curry tore his last year. They were a little bit more kind of clandestine about it too, but that's usually 4 to 6 weeks. But he also, they talked about, Ray, having a really bad bone bruise of the tibia, the lower leg bone, the shin bone, right? So that is actually fairly similar, and in his case, when they do an MRI, you see that there's blood or bleeding and there's these subchondral-like fractures, and I think that's what has the medical staff, that's what would have me most worried about Kevin Durant's recovery, is how long will it take that tibia to recover as well as the torn ligament in his knee, the MCL. Now over to Andrew Bogut, his was leg whipped. I have to admit, when I first saw it, I didn't think it was with enough force to fracture a bone as strong as the tibia bone. And one of my concerns is the possibility in a guy like Bogut, did he have an underlying injury? If you remember, he kind of got rolled up on last year in the finals, and I wonder whether there was any underlying injury that could have predisposed him, because I wasn't so sure that I thought there was enough force for a tibial fracture, but that's a big bone, the shin bone, and for him to have a fracture, a very, very long-winded way of answering your question is that I think he's probably out for the year.
Now, through your education with me, take me to the tibia bone and its healing efforts. Is there plenty of blood flow here? Does this bone normally heal well? Or is this take some time to heal, and how strong is this bone?
Yeah, this is a strong bone. This is not one of those bones, and I think where you're going, gosh, Ray, you could come and join our staff. You're so good on these sports injuries now, is that we talk sometimes about bones that have poor blood flow and don't heal well, that really worry us in the sports medicine world. Typically, the tibia isn't one of those. The tibia usually, especially with traumatic fractures, will heal pretty well. So an injury that you break the tibia with one blow like this. Now, if he has an underlying problem, or you have a stress fracture in a certain part of the tibia bone, those are ones that don't heal as well. And not knowing that at all, but being a little suspicious in that and how this injury occurred, I think there's a real chance that Andrew Boguts could take a lot longer. And the really odd part about this whole injury, we may not see him again, because he looked like probably a rental player for the year, and we might have gotten a 58-second look at him, and that may be all we see of Andrew Bogut in a Cavs uniform.
Sometimes when we're talking with Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, sometimes you'll say because we compensate for other things, we'll get some other injuries. Now, obviously, a leg whip, you can't help with that, but because he's had some knee issues in both of his knees down there, could that have something to do with maybe some putting extra pressure on that leg, that tibia through the years where it made it weaker, or no?
Yes, no question about it. And that's why I'm really, really fortunate in where I'm sitting here at Akron Children's Hospital is I have these young athletes, Ray, that for the most part, this is their first injury. They don't have a lot of baggage. They heal really well in younger age ranges. And this is exactly why I chose not to see those weekend warriors and professional athletes and stuff. Really, I'm saying that tongue-in-cheek a little bit, but there is almost always in professional athletes some underlying baggage. And considering that picture in my mind's eye of last year, the way Bogut got rolled up on last year, yes, I totally agree with the statement you made that I think some underlying injury to his knee and or tibia from last year. We never know exactly what his injury was from last year. That's one of the first things I thought when I saw that, as you heard from LeBron and others on the bench, they heard it crack. They knew he didn't want to bear weight. We knew it was really a bad sign that he needed to be helped up right away. Yes, I think some of the baggage from old injury probably played a role here.
Great stuff this morning, Joe. Thanks for the visit, my friend. We'll catch up with you next week.
Okay, Ray. Thanks a lot. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. Reset button there.